Minister of Social Development, Ms. Lindiwe Zulu, has called this media briefing to update the nation, especially the social development sector, on the impact of COVID-19 adjusted level 4. The Minister will do this within the context of the portfolio, the entire DSD social development portfolio, which includes SASSA as well as the National Development Agency. The Minister will also issue directions in this regard. Without wasting any more time, I'd like to call the Minister of Social Development, Honorable Minister Lindiwe Zulu. Thank you.
Hey, bazoxosha labantu ngoba uspraya kakhulu, but you need to spray. Thank you very much, Program Director. The Deputy Minister who connected virtually, SASSA CEO, Dotsi Memela Kambule, thank you very much for coming through. CEO of NDA, Thamo Mzobe, who's connected virtually. Those of the Department of Social Development, SASSA and NDA, who are here today. I can see that we keeping to the protocols of COVID. We're wearing our masks, we washed our hands, we sanitized, and we were checked our temperatures as we were going in here. We're hoping that this is what is happening throughout the country, particularly CEO in our structures. I hope that everyone is very conscious of the difficult times we're going through. Members of the media, thank you very much for those of you who still risk it and come out to get the information and pass the information to our people. We're very much conscious of the fact that you yourselves are taking the risk, but I'm hoping that you stick to the protocols. As we are aware, all South Africa is under level 4 of the risk-adjusted strategy for 14 days due to a resurgence of COVID-19 infections from the virus over the past few weeks. I think that each and every one of us is hearing of one person infected or the other, one person dying somewhere or the other, and families are very much affected by this. What is now clear is that we need to do more together as a nation to bring the new transmissible Delta variant under control, while government is rolling out the mass vaccination programs across the country. Now more than ever, we must pull together and resist the temptation to let our guard down. As a portfolio, as the acting DG has indicated earlier, our most immediate response is to cushion the economic impact of the pandemic and to prevent people's situation from getting worse by intervening earlier and providing appropriate and timely services. In this regard, we have again activated our alert level response measures to deal effectively with the anticipated increased demand for our services. As previously experienced under the same alert level last year, we welcome the restrictions on alcohol sales and under the adjusted level 4, given its contribution to the rise in trauma cases and additional burden it places on our hospitals in the midst of the pandemic. When the country was at level 4 and 5 respectively, we saw a drastic decrease in gender-based violence and femicide cases across the country. This can be attributed to the limited or non-sale of alcohol, which is the most widely used psychoactive substance in the country, especially amongst our young people. About 58% of deaths in our roads are attributed to alcohol. The per capita consumption of alcohol in our country is about 90%, and this ranks in the top 20 per capita alcohol consumption worldwide. That is very disturbing. These statistics should shock us as a country, as it clearly indicates that we have a problem with alcohol abuse, and there is a direct correlation between this and the rising numbers of GBV, which the President Ramaphosa labeled as the second pandemic after COVID-19. We therefore call upon South Africans to be more responsible in the manner in which we consume alcohol, given its serious consequences. We also encourage citizens to report gender-based violence and femicide incidences to our 24/7 Gender-Based Violence Command Center on 0800 428 428, 0800 GBV. Citizens may alternatively request a social worker from the command center by dialing *120 *7876# for free from any cell phone, or sending an SMS to 31531. We will soon issue directions in terms of Section 72(2), in terms of Section 27(2) of the Disaster Management Act 57 of 2002, which details the measures to contain the spread of the virus from a social service perspective under adjusted level 4. We have gone back into looking at what were the lessons that we learned at that level 5 and 4, so that we can use the experience that we got there in terms of ensuring that our services reach as many people as possible. So the lessons that have been learned there are very important for this current level in where we're finding ourselves. With regard to the different community services, I'm going to just go through a few. The first one being Community Nutrition and Development Centers, what we normally call CNDCs. One area that is likely to experience increased demand is food for vulnerable households. All of our 250 Community Nutrition and Development Centers, CNDCs across the country, will remain open to provide the much needed relief, but this will be under strict COVID-19 regulation compliance and will be limited to the takeaway meals only. We have also adapted our operations to new and innovative ways that include knock and drop approach of cooked meals to minimize the health risk of those aged 60 plus. Our CNDCs assist with food storage and distribution to poor households, and are also part of the community-driven food nutrition and security programs, which increase access to food security to vulnerable and disadvantaged communities, especially at this time of need. All CNDCs have amended their operations to ensure precaution that prioritize the health and safety of recipients and staff who are at the front line of our efforts. It is important to stress that these measures are not substitute to other COVID-19 protocols, as beneficiaries have equal responsibility by continuing to follow the guidelines, which include the regular sanitization and washing of hands, wearing of a mask that covers both mouth and face, and maintaining a distance from others at all times. On a related matter, we continue utilizing a hybrid model and providing food parcels, that is cash, food parcels and vouchers through the 9 provinces and through SASSA Social Relief of Distress programs for eligible households in distress. Once again, we express our gratitude to individuals, organizations, including the faith-based sector and the private sector, that continue to make food donation to our centers, ensuring that individuals and families do not go to bed hungry. We are mindful that the economy is taking serious strain at this time and families may be distressed, and we urge all citizens to continue supporting those most in need. Let us not tire on doing good. South Africa has enough food to feed its own people. It's a question of how do we make sure that those that do not have the food, we coordinate and make sure that they get the food. The other area which is of major importance to us is the registration of non-profit organizations, what we normally call NPOs. All in-person NPO services are suspended, and we are encouraging citizens to make use of the DSD online platform, which is www.npo.gov.za for NPO registration and submission of annual reports. It's important that annual reports be submitted. We reiterate our call for NPOs to ensure that they remain compliant with the NPO Act to avoid being deregistered. We further would like to assure all NPO applicants that their temporary certificates will be issued to them via email, whilst the original certificates will be provided for at a later stage. Transfer payments to NPOs. Our provincial departments are making progress with the transfer of funds to NPOs whose efforts are more important than ever during this pandemic. However, we are mindful that some provinces are experiencing delays attributed to system change, delays in finalization of service level agreements, and human resource shortages, among others. I have directed all provincial departments to ensure that they move with greater speed in processing these subsidies. We take this opportunity to call on the NPO sector to comply with all accountability requirements, including timely submissions of progress reports as required by law. And with DSD facilities, in the face of the easily transmittable variants of the virus, we need to remain alert to ensure we protect those most at risk. Visits to residential facilities for older persons, care facilities, and other congregant settings are therefore prohibited during the current alert level. Recognizing the psychosocial and emotional toll this might have on our senior citizens, their families and friends, we appeal for understanding and urge families and friends to continuously keep in touch through telephone and video calls, as well as make use of the new ways of connecting with our loved ones via virtual platforms. I know many would say it's easier said via virtual platforms. It's not everybody that is able to connect, but we all must have an appreciation of the fact that the most vulnerable people with comorbidities are those elderly people who are in our centers, but it also goes beyond those that are in our centers. It also includes those that are at home. Hence, we call upon everybody to be really, really sensitive and conscious as they go out and come back to be with their grandparents and great-grandparents. We are taking these extra steps to support the health and safety of our senior citizens and staff at our facilities. We are pleased that most older persons in our residential facilities have now been vaccinated. As of 23rd June, 3.5 million older persons have registered for vaccinations since the beginning of phase 2 of the mass vaccination program. We are working jointly with the Department of Health, the Medical Research Council, community and faith-based organization, community health workers, and community caregivers to maintain the momentum to ensure that older persons, particularly the most vulnerable among them, have access to COVID-19 vaccinations. We do this by providing information, address vaccine hesitancy, and assist with the registration process and transportation to vaccine sites, amongst others. And this is done particularly by the DSD at provincial level. We are pleased that some provinces are operating drop-in vaccination sites wherein older persons can get vaccinated without an appointment. To support these measures, we have deployed our social service professionals, social workers, and community development practitioners across the country who stand ready to assist to ensure no one is left behind. They will be strategically deployed to target and register older persons for vaccination at places such as shopping mall, post office, and pension payout points where they collect their social grant payments, at retail stores, service points, and access points. On this note, I want to make a direct personal appeal to all our senior citizens who have not yet been vaccinated. Now is the time to get vaccinated. The vaccines are safe and a better way to protect yourselves. I'm still standing. I've had my first jab. I can't wait for the second one. So there we are. It's a plea to the elderly people, and it's also a plea to the younger generation who can be able to read what is out there and explain to the elderly the impact and effect of us being vaccinated, and especially the elderly being vaccinated to be protected. The other area of work which belongs to, so far at the moment, still is with the Department of Social Development, is Early Childhood Development Centers, which we normally call ECDs. Under the current alert, all ECDs remain open and in full operation in compliance with all COVID-19 protocols and guidelines as previously provided to the sector. Our provincial departments will also continue to pay full subsidy to ECD programs. We are aware that we did not complete payments through the stimulus package to all qualifying applicants at the end of March 2021. To this end, all provincial departments have applied for the rollover of funds as per the budget process, appreciating that if money has not been spent, many a times it goes back to Treasury, and Treasury decides what needs to be done with that money. But in this particular case, we were able to negotiate and have conversation with Treasury, who then enabled us to do a rollover. So those who have not been paid will be paid. To this end, all provincial departments, let me take this opportunity to assure all qualifying ECD services that they will definitely receive their payments. Provincial treasuries assist with this matter, and we expect payment to be made within the next few weeks upon receipt of the confirmation letter from the provincial treasuries. We have given a second chance to enable those ECD services that captured their details incorrectly during the first leg to make corrections. In this regard, we are pleased to announce that we have opened the system again for all ECD services and practitioners who have received text messages to correct their information, and we appeal to them to do so urgently as possible, as this will not be open for a long period. This will assist in fast-tracking all outstanding applications and verification process to be run and payments accordingly done. This can be done through accessing the website, which is www.ecd.gov.za. Still on this matter, I would like to inform the sector and members of the public that the Presidential Proclamation on the transfer of ECD functions from the Department of Social Development to Basic Education was published yesterday, 1st July 2021. Our joint teams are hard at work to iron out all outstanding matters to ensure a smooth transition, and also to indicate that while there is that move, Department of Social Development remains fully responsible for the ECDs at the moment. Ladies and gentlemen, with the rollout of phase 2 of the mass vaccination program now fully underway, we are at the advanced stage in negotiations with the Department of Health to ensure that inclusion of social sectors frontline workers in the priority groups for vaccination. These include men and women who continue to provide services to vulnerable groups and serve our nation as social service professionals, ECD practitioners, and SASSA employees in the front line. Further announcements will be made in the coming days, and I'm very much aware of the fact that SASSA is really running at a very low number of workers in the offices due to infections. And I do really want to take the opportunity at the moment as CEO and ADG, that I've always said, if you can't protect yourself first, how then do you think you are going to be able to service the people? Because the services that's needed by our people is very important. They survive through the SASSA grants, they survive through all the other grants that we give them. So I am thanking the staff who wake up in the morning and do everything that they can, those that do go to the offices, because we are also sticking to the numbers as according to DPSA, but also those who are at home, who do not say, well, I'm home right now and the CEO can't see me, the ADGs can't see me. People who are committed, who wake up and continue to do the work. With regard to the National Development Agency, the NDA remains committed to providing services to civil society organizations, and this will be done in line with adjusted Alert Level 4 regulations, which protect both staff and stakeholders. All physical training for CSOs will be suspended for the next 14 days. However, all NDA offices can be accessed on both the national and provincial telephone numbers on the website www.nda.org.za. Alternatively, call the national office number on 011 018 5500. And with regard to SASSA, Given that social grants are a lifeline for many vulnerable individuals and households, particularly during these difficult times, our aim is to ensure that there are no disruptions in services that SASSA renders. Throughout the COVID-19 response, we showed our ability to respond quickly and effectively to new levels of demand. We have introduced a number of significant innovations that we now have an opportunity to build on as we strive to improve client experience and meet current demand and respond to the felt needs of our people. In this regard, we'll continue with the staggered payments of grants, with the first payment date reserved for older persons, followed by disability grants and the payment of all child grants. This month, payments of social grants will start on Tuesday, 6th July. Once again, we appeal to all grant recipients that they do not need to collect their grants on the day that it becomes available, but can collect their grants on any day, as their monies will remain in their accounts and will not be taken away from them. And having said that, I'm of course conscious of the fact that by the time the money comes from SASSA, most of the time people do not have money, and therefore they have to rush to go and get the money because they've got to get food and all the necessities. But because we are struggling with COVID-19, it is a plea to our people that they try and make sure that they don't go in their big numbers to collect their social grants for their own safety. While all SASSA offices will remain open, they will operate with a reduced staff complement as per the DPSA circular. Applications for social grants at all local offices will be staggered according to grant type. For instance, Mondays will be for the older persons, Tuesdays for disability grants, Wednesdays and Thursdays for child applications, Fridays for appointments, and spillover from the week. I think what we will try and do is to try and communicate as much as possible so that people do not then go to the center where they are supposed to get their grant only to find that they do not fall onto that day. It's important for the provinces in particular to assist in that way in terms of communicating to citizens. Some of the changes we made during our response to COVID-19 and enable us to fast-track digitization of our services. These include the online booking system for disability grants, which has significantly cut down on the amount of time and cost for both SASSA and grant applicants. We take great pride with the significant progress we have registered since the launch of the online booking system in April this year. We therefore would like to encourage disability grant applicants to make use of the SASSA online booking system, which is www.sassa.gov.za. This will allow applicants to book assessment dates for disability assessments. Our staff at SASSA offices can also assist clients with this system to ensure that they avoid repeated visits to the local offices. Our call center remains functional, and I know that sometimes people complain, they call and they wait for long. We are committed to keeping on improving even on this call center. We are appealing to citizens not to report to the call center in person, but rather to lodge their queries by phone on 0800 601011 or through email at grantenquiries@sassa.gov.za. Fellow South Africans, the days and weeks ahead will be the hardest, as some scientists predict that the third wave will reach peak in October. And that is why it is important for every one of us to observe the protocols and that we exercise the greatest possible personal responsibility. And as I conclude, I would therefore like to join President Cyril Ramaphosa in calling for the observance of all health and safety protocols. We must always wear a mask in public. We must regularly wash or sanitize our hands. We must always keep a safe distance from others. Unless it is necessary, please stay at home and stay safe. I thank you.
Thank you very much, Minister, for that briefing and statement on the measures or the impact of Alert Level 4 on the social development sector, which have already started being implemented in line with the discussions that we've had with provinces already. At this point in time, we're going to take questions from the media. We will start with those who are in the house, and then we will go virtually. Ignatius is going to help us with questions that come on the WhatsApp group. Can we start in-house first and check whether there are any media questions from members of the media who may be here? I see one. I think, please, thank you. Please introduce yourself and then shoot to the question. If we could be as direct as possible, it would be useful so that we can save time. Thank you very much.
This is Aviwem Dila from ENCA. Minister, just on the 350 Rand social, that 350 Rand social release of distress grant, I understand. Just an update, maybe what's going to happen to those that have received it fraudulently? Any plans around that? And maybe going forward, is there a possibility, because there have been a lot of calls to have it come back, given that people now are in a tighter lockdown? Is there a possibility of it coming back into the system? And just around even the SASSA payments, given that you mentioned yourself that we're going into the October, which is going to be one of the toughest periods, wouldn't these queues that we normally see around those payments be a cause of concern?
Thank you very much, Aviwe. Is there anybody else in house? Okay, thank you, Ignatius. Can we go virtual?
Thanks, Chair. Currently, there's no questions on WhatsApp line.
Great, which means the statement is pretty clear. Thank you. Minister, one question around the SASSA grant payments from Aviwe. We'll give to the CEO of SASSA to come and respond specifically to that. And then Minister will come in immediately after that. Thank you very much.
A very good afternoon to the listeners and the viewers at home. Siyabingelela namhlanje ekseni. The first question that was asked was, how are we going to deal with the people that were paid fraudulently, which this actually covers a number of categories of people. The first category is those inmates that applied for the grant prior to the time when we had the database from correctional services. The advantage was that many of them, because we wanted the money to be collected physically, they couldn't collect it. So even though the money was paid, they did not collect the money. That's about 105 inmates. It doesn't mean that because they did not collect the money that it means it was not a criminal offense. So we're working with the Fusion Center, which is looking at all the different categories of fraudulent transactions that happened at the start of the pandemic, to make sure that one, due process is continued in terms of making sure that those people are punished, and in terms of those people that have actually received the money, we need to get the money back. The other group of people include those people that transacted outside the country. Fortunately, in terms of that category of people, it's a process that we put in place as SASSA, because we know that we understood that some of the people had left, and in terms of our regulations, you cannot collect money from outside South Africa because this is dedicated to South Africans. So what we then did, we stopped all those grants, having done an analysis of people that have transacted from outside the country, because if you can transact using a card, it means you can be able to withdraw money anywhere. We then stopped those grants, which therefore means that we're now investigating as to first, why are people getting those grants? Are they really duly South Africans? And we've stopped those grants, and we'll deal with them as on a case by case, but those were stopped. The other key category includes 241 public servants that had also received grants erroneously. What has become interesting is, as we investigated that, we noted that many of them were actually learnerships and not necessarily people that are your traditional public servants. It doesn't mean that because they were learnerships, they did not do anything wrong. So what we've done with the DG wrote to all the DGs to sensitize them of all the people that have received this grant to establish first as to whether they are still in the system, but secondly so that we can collect from all those people that have received. So with regards to those people that were paid when they should not have been paid, we're going to continue with the process of one, making sure that, because when you applied for the grant, you actually had to indicate that you're applying for the grant because you don't have the money, which therefore means that it becomes a criminal offense. The second process becomes to actually collect that money. So on that issue, that's what we've done. We've acknowledged the fact that there were, because of the stopping and continuing with the agreement on us to continue with the grant, there are some people that were continued to lag behind in terms of payment. We have cleared the bulk of the people that we had not paid previously, even though we still have remaining people that have not been paid for February, March, and April, particularly those that have actually done motivations to say, yes, you may have picked me up from the UIF system or from whatever other system they've actually motivated to say, I actually am not employed. So we've dealt with those, and many of them, because with that particular category of people, what we also have to do is to also check in their bank accounts as to whether they actually don't have money. So we've also processed many of those. There are some that were found to have applied using ID numbers of people that have passed on. It does not always necessarily mean that the person is fraudulent, even though there's others that had applied for people that have already passed on, I suppose not recognizing that we're able to pick it up in the system. So we had to take those people and assume that they are risky clients. So we've gone back to all of them and asked them to say, please do confirm that, one, that the cell phone number that you've used is of a deceased person, and you are going to give us your a cell phone number so that we don't use that cell phone number. So half of those people have since been paid. Those that we have confirmed that they are not fraudulent, it's because they just used the cell phone numbers of people that may have been family members that have passed on. So that's how we've dealt with those. But our intention is to make sure that in the next 30 to 60 days, we've cleared the floor. We've paid everybody that we have not been able to pay through this process. We've identified, in terms of number of transactions and not number of accounts, we've identified 1 million transactions that we haven't paid, and we're weekly paying those accounts. In some instances, you may find that there's a person that was paid for some months and not all the months, and we're clearing the floor to make sure that everybody that is in the system has been approved actually gets paid. It's 750 million that is outstanding that we're processing. In terms of that was received fraudulently, in terms of the numbers that had been agreed on previously when it was about 1.0.6 in terms of the total funding that we had. I just don't have at the top of my mind as to what the actual number was. But I know that the percentage was a very low percentage, which does not justify the fraudulent transactions. Thank you.
Thank you, Aviwe. You had the question about the 350, and I think the CEO has adequately covered that one. And you also asked about whether the 350 will come back or not. From a department point of view, we long even before the end of the last, we had already made our requests. But of course, we're very conscious of the fact that the finances we're not doing very well overall as government. We did submit our request for continuation, and we're basing ourselves on the fact that we're not only looking at COVID-19 from a point of view of what will happen in the future, we're even looking at what had been happening and the impact thereof on our people, because for us to recover and for the most poor of the poorest people that we have in South Africa, the recovery is going to take long. The impact of COVID-19 has just been devastating. So we were basing ourselves firstly on the information that we're getting as we sit in the meetings of the net joints as well as the Npos, and we're looking at what was coming, which we are now in right now. We are in the third wave, and I think when I spoke there, I think this issue of a peak in October, I think that is not correct actually, because we are in the third wave already right now. I think that was just a small mistake that was made there. We are in the third wave, and therefore we still are waiting to see whether it is going to be possible to extend the 350. And the basis for our request is those that did research around the impact of the 350 to families. We felt that if we are going to be getting into the third wave, if we are going to be seeing people losing their jobs, as we can see how much people have lost their jobs, and we're also considering that it's really going to take time for people to get back to normal jobs. And here we are now. We are in the third wave, and I'm sure you've also been listening to the data, the facts and the figures as to how many people have lost their jobs, in particularly how much young people are unemployed. So we wait and we engage, but we are committed to continuing and engaging. But I do want to say that we are also very conscious of the financial constraint and the financial strain that Treasury is also going through. Thank you very much.
Thank you very much, Minister. Aviwe, sorry, not Aviwe. Ignatius, still no questions on WhatsApp. We have one. Let's take that.
Thank you, Chair. I have Mary Ann Khotsana from Ground Up News. It's directed to the Minister. She says, can the Minister please clarify regarding the Stimulus Relief Fund? Does the second chance given by the department also apply to ECD practitioners that had not applied in the beginning? Can they apply now? Or is it just those who have applied and received text to correct their information? Thank you, Chair.
Thank you very much. Okay. Let me provide the response to that. Do you have a last one? Because of time.
Yes, there's another one. Just came in now.
Let's take the last one.
From Molimo, from SABC News. It says that child and youth-headed households are some of the hardest hit as their country crumbles with the third wave, and obviously their situation has been worsened by the pandemic. Are there any extra interventions taken to further address their needs? Thank you, Chair.
Thank you. I'm going to ask Isabella to come and assist us with the response to the ECD, and then we'll ask the Minister to come in on the other one. Thank you very much. Isabella?
Thank you very much. Good morning, Minister, Deputy Minister, Acting DG, MECs that are also online, colleagues and the people of South Africa. With regard to the ECD stimulus package, currently we are going to only allow those that have applied for the stimulus package, those that have received, SMS, because the rollover that we applied for was basically for those that have applied, and the funds are limited to that. So if we open for new applications, I think we won't be able, to cope with that. That's with regard to the stimulus package. The issue of the children, the child-headed households, I think we are quite aware that there are various programs that are put in place, an initiative by government the issue of food relief, just to mention one of it, those children will benefit from that. But however, we also as the department have got our own initiative, the community-based prevention and early intervention program that was used to be called Isibindi, where our child and youth care workers are at the forefront, and we've got, you know, those facilities that are doing very well, are taking care of those children, and even the single-headed, we have seen the single-headed parents during the Child Protection Week. Minister had an opportunity to engage with one of the fathers who are heading, you know, the families, who had a testimony of saying that the programs that we have put in place are really making a significant impact, you know, in the lives of, you know, the child-headed household and the single-headed parents. So those programs will be utilized, you know, to ensure that we deal with the issue of the child-headed households. Thank you very much.
Thank you very much, Sisebenza Sonke, and one of the things that I would like to also indicate is the fact that we trying to strengthen the coordination between ourselves as national, provincial and local structures. We also trying to strengthen our monitoring and evaluation at national level to make sure that issues of child-headed households are dealt with by the local people at a local level, because we are here at national. The people who see these on daily basis, as it has been indicated, those are the people who are at the local government. And it is for this reason that as a department, firstly, we agreed that we need to strengthen our portfolio so that what SASSA needs to do, what NDA needs to do, what the national department itself has to do is properly coordinated so that we reduce, for instance, the challenges of wastage along the line. But also I'd like to really thank the NGOs and Npos out there. Besides the centers that we are talking about, we've got a whole lot of goodwill among South Africans, and I'm saying this out of the experience of visiting some of these centers and seeing that what we are providing as the department and as a portfolio might not necessarily be adequate, but I'm also aware that there are foundations that are doing the best that they can to make sure that they support our centers. But there are foundations who also have data about the child-headed households who always go to those homes and drop food and also engage. And lastly, I also want to thank the social workers in this particular point, because it is the social workers, as I experienced in Johannesburg, it is the social workers who go to the centers we are talking about, but also it's the social workers who go to the homes which are child-headed households. I just believe that as South Africans collectively, if we want to see the change that we want to see, we've got to be able to pool our resources together, government, private sector, the public, as well as those who would want to contribute towards a better South Africa. Thank you.
Thank you very much, Minister. And thank you for confirming indeed the fact that all child protection services of the department are in place and fully operational, and indeed through the assistance of NGOs, and our provinces are working hard in this regard. And thank you also for appreciating the work being done by our social workers on the ground. And of course, the Minister made the call that members of the public can indeed contact the department in instances where there are children who may be destitute, etc. So thank you very much for that, Minister. We don't have any more questions. Ladies and gentlemen, we want to thank you for participating in this very important media briefing. Minister, thank you. Deputy Minister who's joined us virtually, MECs who may have joined us virtually, our CEOs of SASSA and the NDA, and all members of the public and of course members of the media. Thank you very much. We bring this media briefing to a close. Thank you.